All right. Thank you so much, Hannah, for getting us started. And thank you all for joining us here this evening. I'm Dr. Altobelli, and I'm very excited to be here talking with you and your daughters about puberty. All right, so let's jump right in. Just a little bit about me. I did my medical training in Texas. I was at Baylor in Houston for undergrad and residency, medical school. And then I came here to the beautiful Pacific Northwest about 4 years ago now and joined with Allegro. I also bring the experience of being a tween and teen girl myself. But disclaimer, one thing I don't have is a daughter. So I have not had to talk to my own daughter about puberty, but I do have a wonderful 10-year-old son who has heard about it. And I have many of your wonderful daughters as patients who I get to talk about this. So just a brief overview of what we're going to go over this evening. We are, first of all, going to talk about how to talk with your daughter about puberty. We are going to go over some basic puberty facts, and we are going to talk some about how to feel confident and prepared as your daughter gets ready to go into puberty. And then finally, at the end, we'll have some questions and conversation. All right, so the first part, how do we talk about puberty with our All right, so this is the interactive portion of the talk. So question one, and this is for everyone, parents and daughters alike, what was your experience like learning about puberty? No one told me anything. It was embarrassing and or scary and or confusing. It was great. I felt confident and prepared afterwards. Or this is my first time learning about puberty. So I'll give everybody a minute to think about that and put in their answer, and then we'll keep. And it occurs to me as I'm reading this again for the whatever number of time that the first thing and the last thing are actually very similar, but the first one was thinking about for us adults, what our experience was like. Okay, perfect. So yeah, this sounds about like I expected. A lot of us thought it was embarrassing or scary, or we didn't get very good information. And a few of you out there got great information and felt good afterwards, which I'm so glad to hear. And for those of you who didn't have the best experience, hopefully we can work on that this evening. All right. So how do we talk to our daughters about puberty? The first thing that I want to stress is make talking about puberty a safe environment for your daughter. Don't let her come to it feeling like she's going to be shamed. She's going to be embarrassed. There's no way to talk about it without being embarrassed, but you don't want her to worry she's going to get in trouble. So let her know that she can ask you anything, that you're not going to be mad or judge her, and that you want to have this conversation with her because it's better that she talk about it with you than get that information elsewhere, right? See what your daughter already knows about puberty. A lot of girls have some ideas already, and you don't need to sort of lose her attention by starting off with a bunch of stuff she already knows, and really all she wants to talk to you about is, well, what's going to happen when it's time to shave my legs or something like that. And so that kind of goes along with the next point is ask what your daughter wants to know in addition to finding out what she already knows. So, get a sense of where she is already. Like a lot of girls have heard about periods, but they may not know any of the other aspects of what goes along with puberty, and they want to find out. So see what she knows, see what she wants to know. And then my last piece of advice about talking with your daughter about puberty is actually use correct medical terminology. So, many of us grew up in times and cultures where we use a lot of euphemisms to refer to women's body parts, and that can make it very confusing for your daughter if she does not know what you're talking about. It also kind of sets the tone that there's something embarrassing or shameful about women's body parts, and that's the last thing we want to imply, right? We want girls to be proud of their bodies and feel empowered to know about them and learn about them. So we all have to get used to saying those uncomfortable words like vagina, right? Because it's important. So we all know what we're talking about. So I just tell people, you know what? Before you have this talk with your daughter, practice saying it out loud. And this goes for the basic puberty talks at the beginning and further talks about sexuality down the road. Just saying it out loud so you don't give up or stumble or when the time comes to talk to her about it, right? There's body parts. We all have various combinations of these body parts, and we should be able to talk about them. All right. Part two is talking about puberty itself. So what is puberty? When does it happen? What's the process like? So sometimes we use the analogy of a train to discuss puberty, because we say that the puberty train comes when it's going to come and takes as long as it's going to take to get there. And you just hop on the train when it comes and ride it till it's done. So here comes the train. This question is for the girls. Are you looking forward to puberty? Yes, no, or I'm not sure. Okay, so yeah, a lot of I don't really know. And then kind of, roughly similar amounts of yes and no. I'm glad to see there's at least some of you out there that are looking forward to it. That's great. I'm glad, because there's a lot of exciting aspects to it too. Not all bad news. All right, so let's talk about puberty. Let's talk about when it happens. So the puberty train normally arrives anywhere between age 8 and 14, and that's a pretty widespread, right? So that's, from elementary school to high school. All of that is normal. So I'm going to say this a lot tonight because it's important for you to understand all the things that are normal about puberty. And one of them is if it comes to you starting age 8 to 14, that's all normal. Your friend might not get it for another 3 or 4 years. It just happens when it happens. On average, once you start going through the process of puberty, it takes about 4 to 5 years before it's complete. So in the next slide, we're going to look at some body parts that kind of show the physical outward changes that happen with puberty. So I just always like to give people a little warning. Here comes some cartoons of body parts. We're not used to looking at this, but it's important that we know what we're talking about. All right, so puberty, we say in the medical field, goes in 5 stages. They're called Tanner stages. And stage 1 is basically having a little girl's body, right? Before you've started any puberty, this is what you look like when you're a baby to whenever you start puberty. Stage 5 is an adult woman's body. And this is when you basically have the same features as a fully matured female. So the stages you progress through, stage 2, start to get little breast buds. So you can see on the side view of the chest there's a tiny little bit of tissue underneath that nipple and a little bit of hair starting to grow above the labia. Stage 3, the breast grows a little bit more, the hair grows a little bit more. Stage 4, the breast is fully sort of developed in shape, but not necessarily size. Some changes that happen to the nipples, the hair gets a little bit coarser, darker, more spread out, and then stage 5 is fully mature woman. So around stage 2, this is the age where you're going to be thinking about training bras. You're going to be getting new clothes pretty often because you're growing so fast during stage 2. So this is like your shopping stage for clothes and bras. And then most girls get their first period around stage 3 to 4, somewhere in between stage 3 to 4. And so that's when you get your first period, which we call menarche. And that whole process, going from stage 2 to first period, usually takes about 2.5 years. So a lot of times I get questions, when girls come into the clinic and they're just barely starting to get breast buds. Well, am I going to get my period soon? You just are starting to get breast buds. You probably have some time. But one of the things we look at as doctors when you come in for your checkup is we assess how far you're getting through puberty, and we can give you a rough idea of when your first period might be. But it's not an exact science. It's different for every woman. Some girls get their first period about the same time their moms do, but not all of us. So it comes when it comes. And that's, again, one of those things where if you're worried that you haven't started puberty yet, if you're getting, to be 13, 14, haven't started, or you started a long time ago, but you're not progressing, that's absolutely a reason to go talk to your doctor and see if they have any concerns with anything's amiss. All right, this is a super simplified, basic version of what a period is, okay? So this big pink, happy-looking object in the screen is a uterus, a stylized uterus. These fluffy little yellow clouds on the side are the ovaries. And the very basic version of what happens during a period is that you grow some very blood-rich tissue on the inner lining of your uterus. It grows during the course of a month, and then if if no baby happens, if you're not getting pregnant, then all of that tissue crumbles away and it comes out down through the vagina as drops of blood and little bits of tissue. And so that's the bleeding that comes with a period. So the thing I want you to take away from this, if you take nothing else away, is that even though there's blood involved, it doesn't hurt. And so, it's not like when you cut your finger and you bleed and that hurts. This is very different. You may have heard some women talk about the cramps with their periods. That is totally normal. It can feel kind of like a squeezing or pressure sensation, but it's not like a bad, sharp pain when you get your period. If you're having really bad pain with your period, that would be reason to see your doctor too. But that's very rare. Most of the time it's nothing or a little mild cramping, and that's it. So, there is so much more to puberty than periods, right? Those fluffy little, yellow organs that we were seeing in the last slide, these ovaries, they're responsible for putting out a bunch of hormone called estrogen. And that estrogen is going to do different things to all different parts of your body. It's going to change your skin. It's going to make you more prone to pimples and acne, make your skin a little more oily. It's going to make changes to your bones. Your bones are growing faster than ever. This is why during the puberty years, it's really more important than ever that you make sure you're getting good nutrition, right? You want to get your calcium and your vitamin D so that you can lay down nice, strong bones for your future. It's important as you're going through all this growth too, that you get plenty of sleep. Your body does a lot of growing, healing, and repairing while you're sleeping. So even though sleep feels like it's getting more and more elusive as you go into teenage years, it's really more important. It can make changes to your hair too. It can make your hair coarser, thinner, more oily. There's just a lot of different effects that it can have on your body, and it's important to keep that in mind. And then, of course, there's what's going on inside your body. So as girls and boys go through puberty, the hormones that their organs are producing create all kinds of, chaotic, conflicting, and very intense emotions that they didn't used to have. And that expresses itself, often as changes in behavior. And so this is the age when girls are saying things like, I'm crying and I don't know why. Or their parents come to me and say, who is this person that is taking over the body of my beautiful child, because you just seem so different. And that's because you are changing on the inside. All that estrogen that your body's producing is doing things to your brain as well. So we're going to talk just a little bit about that, about your brain and what it's doing in puberty. So I'm just going to keep it super basic and talk about two parts of your brain here: the prefrontal cortex in the front, and the amygdala, which is this funny looking blue egg business in the middle. The amygdala is the part of your brain that is responsible for emotion. Okay? The prefrontal cortex is the part where you do your thinking, your planning, you consider things like consequences, impulse control. Well, guess which part is really busy and active during puberty? Your emotion center. And guess which part is not so developed? That's right. It's the thinking, planning, consequences. So this is why, teenagers can seem very irrational or impulsive or driven by their emotions. It's because they are. It's because they have not developed that part of their brain yet that might be better about helping them decide whether something's a good idea. So that's what's going on inside your brain as you go through puberty. All right, so question 3 for the girls: which aspect of puberty are you most curious or concerned about? And hopefully we'll can talk some more about these. So breasts, periods, body hair, growing taller, or something else. I'm always curious to talk to my patients about this one because I never know what they're going to say. Okay, yeah. So, fair chunk of us are concerned about periods or curious about them, understandably. Getting breasts, a little bit, body hair, growing taller, and then other. So whoever answered other, I hope you asked your question in the chat. We didn't cover it so that we can talk about that. All right, so part three, this is the feeling ready part, okay? How can we not be so scared or overwhelmed by puberty and the changes that are going to happen? How can we get to feeling more confident about this whole process? So, number one, arm yourselves with knowledge, okay? So that's partly what we're doing here tonight, which is fantastic. This might be your first talk about puberty. Maybe you've already talked about it with teachers and parents. Puberty is not just one conversation. It's a bunch of ongoing conversations that will get, have different topics as you get older, as you get more questions. But I hope that, just by sort of that you can, parents, that you can create with your daughters a relationship where they are comfortable asking you questions and talking to you about this so that you can keep talking about it, right? Somebody that's knowledgeable is somebody that feels confident. There's also really a lot of good books on puberty out there. If you just can't stand to have, too much detailed conversation with the parent, girls, that's totally understandable. There's some great books out there, and I'll give you some recommendations at the end. There's websites, some that are better than others. You got to be a little careful on websites, but I'll give you a recommendation there too. And then I think feeling confident and prepared, it comes along with being sort of physically prepared for what if you get your period any certain time, because you don't ever know when it's going to happen necessarily. So if you've, been in puberty a while and you're thinking, you know what, I don't want to get unawares by getting my first period, you can make a little period kit that you always take with you, whether you go to school or gym or friend's house or sport. You stick it in your bag, have a few pads and panty liners in there, maybe an extra pair of underwear, some Ziploc bags to, put anything that gets soiled in. And then I put this picture of this young lady on the slide because she's got a shirt tied around her waist. So that's always a nice little fallback, just in case, heaven forbid you do have like some spotting or accidental staining. It almost never happens, but just in case it does, then that way you've got a little cover up. And, being the Pacific Northwest, there's usually plenty of reason to be carrying around a little light jacket or a cardigan or shirt. So sometimes just having that bag ready to go, can give you some confidence to feel like, okay, no matter what happens, I'm prepared. I know what's happening to me and I know how to deal with it. Yeah. And then I also like to encourage families to kind of prepare to celebrate with their daughters because, there's some downsides to going through puberty, no doubt about it. But getting your first period is also a major milestone in a woman's life. And it's nice if you can do something to celebrate it. And, girls, if you don't want your whole family to know about it or make a big deal, that's totally understandable. But maybe, you can go with another, your mom or another female relative just to ice cream or go out to dinner or something to say, you know what, this is a cool thing that's happening to your body and it's going to be great. All right, so as far as educating ourselves, there are some really great books out there. The Care and Keeping of You, there's a 1 and a 2, one for the slightly younger girls. These are classics. They just turned 25 years old this year, and they're still great. They're relevant. They are, presented in a very non-threatening, age-appropriate way. So those are great starting points. The Hello Flow Guide is a good one. Celebrate Your Body is another good one. I love the body positivity message that it has. Focuses on how many different types of bodies are totally normal and lovely and wonderful. And there's also some literature out there on how to talk with girls who have developmental challenges and disorders like autism, because they're going to process this in a different way. And so books like What's Happening to Ellie are geared toward helping families kind of have that conversation with daughters who might be on the autism spectrum or similarly affected. Healthychildren.org has great, reliable information about all kind of aspects of puberty. This is the website that is backed by the American Academy of Pediatrics. So, you're going to get good information there. And then, you can always talk to your doctor too. We are more than happy to answer your questions about puberty. You don't even have to wait for a checkup. You can make an appointment ahead of time if you want. You can do a virtual visit. Like, we're happy to talk about this because we want you to feel good about the whole process. We really do. All right. Okay, so I think that takes us through my sort of spiel, and then now comes the best part of the presentation, which is the question and answer session. So I'm going to turn it over to questions, and Hannah, I know, is going to sort of feed them to me as we go.
Yeah. So our first question here is, will I get my period at relatively the same age that my mother did?
Yeah, that's a good question. And a lot of the time, yes, but not 100% of the time. Um, so, it's hard to say for sure, but you probably will be close. Now, that being said, there is a trend as generations have gone by. The last couple of generations, girls on average tend to get their puberty and periods a little bit sooner. But the best way to kind of guess when you might get it is, when you have your checkup with your doctor, they can assess your stage of puberty that you're in and give you an idea as well. Great.
Great. Our next question here is, will I get cramps only when I'm on my period, or will I get them just anytime?
Yeah, another really good question. Most girls get a little bit of cramping at the very beginning of their period, usually maybe days 1 or 2, and then it kind of trails off. For some, it lasts longer than others, unfortunately. And every once in a while, girls will get a little bit of mild cramping in between their cycles. So, like from the start of one period to the start of the next period, sometimes right in the very middle, they'll have a little bit of cramping, but it's not terribly common. If you find that you're having cramping like all the time, every day, that would be a reason to see your doctor.
Great, thanks. Our next question is, how long does a period last?
Yeah, good question. So periods last anywhere from 3 to 7 days. Most of us, it's about 4 to 5, but as short as 3 or as long as 7 would be normal. And it tends to be the heaviest on the first, 1 to 3 days, and then slowly kind of taper off after that.
Great, thanks. Our next question, we have a lot of period questions here. So our next question is wondering about how long you'll continue to grow taller after you get your period.
Yeah, absolutely. So most of us, after we get our period, we will maybe grow for another 2 years and maybe grow another 2 inches, but that is about it. So if you are 2 years past the time you got your period, you are probably done growing.
Great. Could you talk a little bit about the difference between pads and tampons and, other options that are out there like cups or period underwear?
Yeah, totally. So there are so many options for how you want to handle your period these days, which is wonderful because it's not a one type fits all kind of situation. Pads are basically just, layered, fibers that come in like a stick-on pad form, and you put them inside your underwear, and they catch the flow of your period before it gets to your panties. And pads come in a huge variety of shapes and sizes, and they're a nice option for most girls when they're first just starting their period and kind of getting used to it. Tampons. So tampons are little tightly wound coils of cotton or other fibers that are actually inserted up into the vagina to catch the blood flow before it comes out of your body. They have a little spring usually that you pull to take them out. And these are great because, they are not as bulky as pads. They can give you more movement, and they're really helpful for girls who are doing sports where they need to be really active or wearing tight clothing or doing things like swimming or gymnastics. And so a lot of older girls, after they've done pads, will kind of graduate to tampons. But it doesn't mean you can't start out using tampons right off the bat. Like if you're a competitive swimmer and you need to wear tampons, you can absolutely learn how to use tampons. And you go over with your mom and you can read about, or your dad, or you can read about in the instructions about things like how to make sure you're using them properly, disposing of them properly, not leaving them in too long. Period cups or diva cups are little rubber cups that actually are sorted up inside the vagina and then catch the flow before it leaves your body. And those you can get, I find those are more helpful for older girls who are a little bit more comfortable with their body and who also are done growing, because you're going to need different sizes depending on your shape and size. So you have to be able to kind of either be comfortable using it yourself, or sometimes you can go to like a gynecologist and they will fit you for one to make sure you're getting a good fitting one. And basically, you leave them in during the day, and then at the end of the day, you empty them out and put the, you flush the blood down the toilet or dispose of it as you go. And so they're nice because they introduce less sort of foreign bodies into your vagina, and some people prefer them to tampons for that reason. And then period panties. So these are getting more and more popular. And basically the way they work is they're just a special kind of underwear that has a super absorbent part to it that you can use when you're on your period, and then you just wash them and reuse them. So it's really, gosh, it's, girls, it's up to you. It takes, sometimes it's a little trial and error figuring out what you're comfortable with. But if you have questions, you can, of course, in addition to talking to your parent, your mom or your big sister, your doctor's advocate to you about that too. And there's a ton of information in those books I mentioned them online. So I hope that answers your question.
Yeah, great. Thank you. Our next question, we have a few questions about how to know when you're going to get your period, and if there's like an age where you should be concerned if you haven't gotten your period yet.
Right. So it's not always easy to tell just based on how you're feeling whether you're going to get your period. Some girls will have cramping beforehand, some feel nothing. There's often before we start our first period, for maybe like a year and a half before, girls will have what's called physiologic leukorrhea, which just means white discharge in your panties. And that's your body kind of getting ready to have its period. You might notice whitish or yellowish discharge in your underwear, very normal. Sign that puberty is working and your period is going to come. If you have not gotten your first period by the age of 14, or if you have started puberty and it's been more than 2.5 or 3 years. So like you're getting breast development, you're getting hair development, but it's been like 2.5, 3 years and no period, then those would be reasons I would go see your doctor. And even then, most of the time, it's rarely anything serious that's wrong. But I would say, no period by 14, or if you've kind of stalled out after having started puberty 2.5 to 3 years ago, you should go.
Great, thank you. It looks like we're at just about time here, but I'll kind of another general question for you before we say goodbye. So we have some questions about when to expect changes like body hair and body odor.
Yeah, good question. So it's different for everybody, but for a lot of us, changes in body odor and having changes in our body hair start before we get our period. So there's some of the earlier signs of puberty. So those can happen, anytime from, anywhere in the early stages of puberty between the ages of 8 and 14. And so there are some girls who need to start wearing things like deodorant because they're already getting adult body odor when they're still in elementary school, and for others it's a bit later. But usually those are around sort of, early stages, stage 2 to stage 3, you'll see changes in odor in here.